Nearly 300,000 veterans turn 65 every year and make the same mistake. They think it's Medicare or VA benefits. Wrong. It's both. And using them wrong can cost you thousands. I'm about to show you exactly how to stack these two systems like a pro. Welcome to 50 cents of advice, dropping dimes of wisdom, 150 cent at a time. I'm Eli Pennywise, and I've been helping folks navigate this healthcare maze since before mail-order pharmacy was a thing. Today's topic matters because the VA itself tells you to sign up for Medicare, but they don't tell you the strategy. I'm covering the 8 ways to maximize both systems, the prescription drug decision that saves most people hundreds per month, and the one emergency situation where choosing wrong could bankrupt you. Plus, I've got a simple decision tree that takes about 2 minutes. Let's go. Here's what most people believe. I earned my VA benefits. Why would I pay for Medicare? Because VA and Medicare don't talk to each other. According to a 2025 report from military.com, the systems operate completely separately. Before every single appointment, you choose which one to use. The VA only works at VA facilities, except in specific emergencies. Medicare works at nearly every hospital and doctor's office in America. You need both for maximum flexibility. Think of it like having cable TV and an antenna back in the day. Cable gave you HBO, but when the cable went out during a storm, that antenna saved you. Same principle here. You're visiting your grandkids in Florida. You have chest pains. The nearest VA facility is 90 minutes away. Medicare gets you into the local ER immediately, no questions asked. According to the VA Compact Act, emergency mental health services are covered even if you're not enrolled in VA healthcare. But for other emergencies, Medicare's your lifeline. But here's where it gets really interesting, especially with prescription drugs. Now, your buddy at the VFW probably told you Part D is a waste of money if you have VA benefits. He's half right, but here's what AARP won't put in the brochure. The first way to maximize both is your prescription drug strategy. VA prescription coverage is considered creditable by Medicare, according to Medicare.gov. That means you can delay enrolling in Part D without penalty, but only if VA coverage meets your needs. Here's the decision tree. If you're 100% service-connected disabled, the VA covers everything, usually with a zero copay. Skip Part D entirely. If you see civilian doctors who prescribe meds the VA doesn't stock, Part D makes sense. The maximum out-of-pocket for Part D in 2026 is $2,100, up from $2,000 in 2025, per AARP's 2025 Medicare Guide. If you live far from a VA facility, Part D gives you access to local pharmacies, but according to a 2024 comparison study, VA mail-order pharmacies beat Part D pricing in most cases. Remember the Kmart Blue Light Special? Attention shoppers, Blue Light Special in aisle 5. VA pharmacy pricing is basically a permanent blue light special on your meds. One Marine Corps veteran told military.com in 2025, "The VA mail-order pharmacy works great for me. Why would I pay $50 a month for Part D when the VA gives me everything free?" If your situation matches his, pocket that $600 per year. The benefit? Keep hundreds in your pocket annually while maintaining access wherever you are. Which brings me to emergencies. The second strategy is knowing which system to use in emergencies. If you're experiencing a mental health crisis or suicidal thoughts, the VA Compact Act provides free emergency assistance. Even if you're not enrolled in VA healthcare, according to military.com's 2025 Veterans Healthcare Guide, dial 988 for the Suicide and Crisis Lifeline. Text and chat available. For all other emergencies, Medicare typically wins unless a VA hospital is nearby. Medicare Part B covers emergency services at nearly every hospital nationwide. A 2025 AARP study found that average ER wait times at civilian hospitals are often half those at VA facilities during peak hours. Remember in Knight Rider, when KITT could find the nearest hospital instantly? You need your own KITT for this. Find your nearest VA emergency center now, before you need it. According to 2024 Medicare data, the average cost difference between an in-network Medicare ER visit and an out-of-network one can hit $3,000. Knowing which system gives you in-network access where you are? That's money in the bank. The benefit? No surprise bills when you're already stressed about your health. Now here's something most people completely overlook about travel. Strategy 3 is your travel game plan. VA facilities don't exist everywhere. According to AARP's 2025 Medicare Guide, Original Medicare provides broader access to hospitals and doctors across all 50 states, critical when you're on vacation. If you choose Original Medicare plus a Medigap policy, some plans even cover foreign travel emergencies. Medicare generally doesn't cover routine care outside the U.S., but in a true emergency abroad, certain Medigap plans step up. Before you travel, pull up the VA facility locator. No VA nearby? Medicare's your primary. It's like when you had your local Radio Shack for emergency batteries, but on a road trip, you'd stop at any store that had them. Coverage flexibility matters. Strategies 4 through 6 all deal with actual care. For primary care, VA teams know your military medical history. For service-connected conditions, care is typically free. Most veterans pay no copay for primary care. The lowest priority groups pay $15 per visit according to the VA's 2025 fee schedule. For specialists, VA specialists are usually cheaper, but wait times can stretch. A 2024 VA report showed average specialist wait times of 28 days. Medicare gives you faster access to local cardiologists, oncologists, whatever you need, but you'll pay more out of pocket. The VA's community care program may cover non-VA specialist visits if wait times are excessive. As of 2025, referral requirements were eased to improve access. Think about this. If a VA specialist appointment is free, but requires 4 weeks and 3 hours of drive time, versus a Medicare specialist who costs you $150, but you're seen next week locally, run that calculation based on your health urgency. The benefit? You control the trade-off between cost and speed. Now, let's talk about the marketing trap that catches thousands of veterans every year. Remember when I said there's a trap? Here it is. Medicare Advantage plans market heavily to veterans. You've seen the commercials. Honor Plan, Patriot Plan, Courage Plus. They promise dental, vision, over-the-counter allowances, and even rebates. But here's what they don't say. According to AARP's 2025 Medicare research, the government pays that MA plan a monthly rate, whether you use it or not. If the VA provides most of your care, you're paying premiums for duplicate coverage you don't need. And the 26 changes tighten rules on non-health benefits, such as life insurance. That benefit package that looked great, it might shift. These ads are slicker than a Rubik's Cube commercial from 1982, all promise, but unless you know the strategy, you're just spinning colors without solving anything. Let me show you the math. If your MA plan costs $30 per month in premiums, that's $360 per year. Add a $25 per month Part D premium, $300 more. You're at $660 annually. If the VA already provides your primary care, specialists, and pharmacy for free or minimal copay, what exactly are you paying for? Dental? You can get a standalone dental plan for $25 to $50 per month without locking into an MA network. The benefit? Original Medicare, plus your VA benefits, often beats Advantage for veterans who primarily use VA care. Don't let patriotic branding cloud your math. Look, I've spent some time researching this exact intersection of VA and Medicare benefits. The data show a clear pattern. Veterans who sign up for Medicare Advantage because of marketing often discover that the VA was already covering what they actually needed. They end up paying for network restrictions and prior authorization headaches they didn't have before. According to 2024 Medicare data, veterans who used both systems strategically saved an average of $1,200 annually compared to those who didn't coordinate benefits. That's not a small number over a 20-year retirement. So here's what we covered. 1. Use VA pharmacies first. They're almost always cheaper than Part D. 2. In emergencies, Medicare gives you nationwide access. Know your nearest VA facility. 3. When traveling, rely on Medicare if VA care is far away. 4 through 6. VA for primary and service-connected care. Medicare when you need speed or specialty access. 7. Don't fall for Medicare Advantage marketing. Run the math. 8. Stay ahead of 2026 changes. The Part D out-of-pocket cap increased to $2,100. If you found this helpful, hit that subscribe button. I post new retirement and benefit strategies every week. And I've got a video on Medicare mistakes costing you $1,000 plus every year that picks up right where this one leaves off. I'll link it in the description. And remember, you earned both these benefits. Use them both smartly.
I'm Eli Pennywise, and that's your 50 cents of advice. Keep the change.